Okay, we're going to be getting started here right at 12, and we'll go till about 10 till. This is being recorded for the internet. I'm pleased to have Dr. Thomas Levy here with us today. I'm Dr. Ron Henning-Hockey, the Chief Medical Officer here. But we're going to be talking about IV vitamin C as nature's remedy for chronic illness, for chronic diseases. We sure hope you feel invited in asking questions. Dr. Ann's going to be the wandering microphone. And so any questions that you have anywhere, normally we hold questions till the end, but in this presentation, I'm going to be kind of interviewing Dr. Levy. And if you have thoughts or questions or something that you want to bring to the table, by all means, raise your hand, and Ann will come and we'll insert that in. So this is going to be kind of off the cuff sort of discussion. So with that said, and we may have some other people coming in as we go. So I'd like to welcome Dr. Thomas Levy. He is he's a cardiologist, an attorney. He's an author. He's written wonderful books. Curing the Incurable was one of the ones that first caught my attention. He's The Primal Panacea is another book about vitamin C. He spent 15 years working with Dr. Hal Huggins, so he's got a tremendous background in the dental causes of chronic illness, which most people and probably most dentists don't realize that these causes have a very fundamental role to play in many illnesses that you wouldn't expect to be related to your teeth. So we'll be talking a little bit about that. This is the third lecture in a series on IV vitamin C. So we want to talk today also about how the IV, intravenous vitamin C, is a quantum leap in the direction of using vitamin C in a way that helps us deal with chronic diseases in a much more safe but effective way, because most of what we know from conventional medicine is use of medication for chronic illnesses. But I know in my own case, I was the medical director of a nursing home up in Salina for 5 years. And unfortunately, the pattern I saw is as people got older and their chronic illnesses began to mount, so did their list of medications. And very often medications were being used to treat the side effects of other medicines. And so with that little introduction, I'd like to welcome Dr. Levy, and maybe you could tell him a little bit about your pathway into this whole discussion.
Well, okay. I was just an innocent mainstream cardiologist about 25 years ago. And I was actually quite bored and thinking there was something else out there, but I had no idea what it was. And then you may have heard the expression, when the student is ready, the teacher will appear. Well, talk about metaphysical, because that's when Dr. Hal Huggins showed up and we met at a conference. Dr. Hal Huggins, he's since passed in 2014. It's a world-leading authority on dental toxicity, mercury, but also importantly the toxicity of dental infections, root canal treated teeth, etc. And I had the opportunity to visit him at his clinic in Colorado Springs and spend some time there. Later on, quit cardiology and just spent full time being a consultant at his clinic. And then when I saw all the horrible BS he was put through for putting the real truth out there, I decided to get a law degree as well. As I like to say, I gradually become a member of every group I hold in the lowest esteem. But Dr. Huggins showed me that medical school had taught me nothing. It taught me facts, things I could answer on a test, but very little worth applying to the care of a sick person. And I saw things at Dr. Huggins' clinic that I had been told for some 50 years, 45 years, just where it's supposed to happen. They were diseases that weren't supposed to get better. They were chronic, they were irreversible, and yet I saw things, and I'm not in the habit of denying what I see. I saw multiple sclerosis patients, wheelchair bound, take their first steps in years after 2 weeks. That's pretty overwhelming stuff. And I saw all the patients, even the ones that were just horribly sick, the type that you would expect to go home and go to bed for a week, just like a college student that gets his wisdom teeth taken out. They go home and they rest for a week. Well, I saw wheelchair-bound patients have so much energy after having had 2 or 3 teeth extracted that they wanted to go out and eat a meal on the other side of the mouth that night. And Hal, Dr. Huggins, had a very sardonic sense of humor. Wry is an understatement. And I said, Hal, what's going on? Why are these people? I mean, I know it's good to get dental infections out of your mouth, but what's going on? And he just pointed at the IV bag. I said, okay, Hal, I know what an IV is. Give me a little more than that. He said, well, it's what's in it. I said, okay, do I have to pull this out and view like? He said, no, there's vitamin C in the bag. Well, like every other mainstream physician, I had never heard vitamin C even mentioned outside of the context of eating an orange. And then I screwed up my face and I said, how much? And he said 50 grams. And so they would come in and they would get before, during, and after their dental protocol, 50-gram infusion of vitamin C. And then subsequently, I started seeing, because I was a consultant, I would review the before and after lab data. And I saw laboratory data that when it's abnormal, it's not supposed to improve. Well, it not only improved, it normalized. I saw patients with lupus have vastly elevated anti-nuclear antibody levels. And 2 weeks later, it was normal. I'm not saying that always happened, but it happened often enough. Saw gout patients with elevated uric acid levels a few days after their dental work and their IV vitamin C, normal. So I said, well, it looks like this is something you need to do a little more research on. And that began the odyssey.
So what I hear you saying, Tom, is that I know when when I was a young medical student, many of the older doctors would refer to their patients as chronics. This is the chronic heart disease. This is the chronic arthritis. This is the chronic fatigue. And the implication was they're never going to get better. And so what you're saying is you saw people who, generally speaking, in conventional medicine, the thought would be is they have no way of getting better. We're just going to nurse them along with medication, but they're stuck with this disease.
That's correct. And I've since seen, as a cardiologist, following all of this, that when you follow certain principles of supplementation and you follow certain principles of avoiding new toxins, you not only can reverse coronary artery disease and make narrowings in your blood vessels lessen and sometimes disappear, you expect it as the rule, not the exception. So there's a lot of stuff out there, and sadly, the docs don't know most of it.
I was going to say, toxins was not something I heard very much about in medical school. And so I hear you referring to toxins in terms of bacterial infections in the mouth relating to toxins. I know this audience is concerned about environmental toxins. What are you referring to when you say toxins, and how does IV vitamin C have anything to do with toxin relief?
A good question. I'm glad you asked that. Actually, toxins are disease. There's really no disease that you can have that's not been precipitated by a toxin. The reason all toxins, 100%, and I don't care what the molecular structure is, all toxins are pro-oxidant, meaning they oxidize biomolecules. Now, what happens when a biomolecule gets oxidized? It loses electrons. And when it loses electrons and becomes oxidized, it's inactive, it's inert. It can no longer perform its normal function that it's supposed to perform, whether it's a lipid or a sugar or a nucleic acid or a structural molecule or an enzyme. We see lots of people, they can't detox anymore because their detox enzymes inside their cells have been oxidized and they're rendered inert. So, whether it's a pesticide, whether it's cyanide, whether it's mercury, whether it's barbiturates, whether it's anything, what determines the pathology is what molecules are oxidized and in what distribution. Now, that should set the stage, because what's the ultimate antioxidant? Vitamin C. So just as a toxin, which the synonym is pro-oxidant, toxin, pro-oxidant, same thing, vitamin C is an antioxidant and will restore oxidized biomolecules back to their normal reduced state. So when you're able to get enough vitamin C where you want it to go, you can repair damage. And you can make, to some degree, chronic diseases disappear or lessen. Very rare that I'm talking about a cure, but most of the time you can expect dramatic reduction in symptomatology, because every symptom is caused by some acute oxidation of important molecules. And I'll take an aside here and say vitamin C is actually a God-given, designed by nature molecule. It's, whether you're an atheist or whether you're a church-going person, this is the molecule that our bodies were designed to receive in order to restore health. It's really that simple. Vitamin C is the main nutrient molecule in your body. All the good food that you eat is only beneficial to the extent that it ultimately metabolizes down to an antioxidant molecule. How well at the molecular level does it donate an electron rather than take it away? Life is electrons and electron flow. And the more electron flow you have, the healthier you are. The less you have, the sicker you are. And when your electron flow stops, you're dead. Really that simple. So, the other thing that dramatically demonstrates that vitamin C is our God-given antibiotic and antitoxin is all the animals in the wild make their own vitamin C. They make it in a 4-step sequence of enzymes in the liver, from glucose, 4 enzymes later, vitamin C. And we, along with the guinea pigs, fruit bats, and primates, lost that enzyme, genetically lost it, genetic mutation. Now, it's a whole other story as to why we had this mutation and why it occurred, but the fact of the matter, it did occur. And the fact of the matter is, most of the wild animals go through their health cycle and their lifespan, and then they get sick and die. The human being, which doesn't make vitamin C anymore but needs it just as desperately, goes through about a third of the lifespan, starts getting sick, and then takes prescription medicines for the last half of their sickly life. Doesn't have to be that way, okay? But you have to start by understanding these principles that the premier antitoxin, the premier antibiotic provided by nature is vitamin C. Now, I'm not saying you should take vitamin C and nothing else, or that you should avoid antibiotics if you have an infection. No, vitamin C just augments everything. Much of the time, it'll do the job by itself. But, and this all, if you will, came to me when I was first working with Dr. Huggins, and I read the literature by Dr. Klenner. We treated several cases of different things together, and I said, how can one molecule, one simple molecule, be the antidote, and it is, for poisoning by anything? Because the Poisoning Control Center shouldn't exist. All that is something that distracts away from taking care of you. If you get bit by a snake, if you get an overdose of anything, the only chance you have to survive is to get intravenous vitamin C right away, and most of the time you will. But I still said, how can one molecule neutralize all these thousands of different toxins with different chemical configuration? I said, it has to be that the toxins, no matter how diverse they are, ultimately cause their toxicity by a final common denominator, and that's oxidation. So, oftentimes vitamin C will repair the oxidative damage, and sometimes, like with an acute snake bite victim, if you get the vitamin C in the blood while the snake venom is still circulating, the vitamin C will donate its electrons directly to the venom and neutralize it before it even has a chance to oxidize anything. And so this is the picture that evolved in the literature, and this is what Dr. Honeyhackey has seen for the last 30 years, is that vitamin C reduces. Reduces is the opposite of oxidation. Vitamin C donates electrons, and all of its properties can be explained by the fact that it donates electrons.
So how in the world would such a wonderful treatment, molecule, nutrient, how in the world did this get overlooked in the modern medical environment? I mean, actually, it's more than overlooked. It's actually decried. It's actually made fun of. Anyone that gives vitamin C is a quack. How did that ever happen with all the research that's been done on vitamin C? Because it was one of the very first vitamins that was discovered.
Wow. Should I be diplomatic or honest?
Let's go with honest. You told me that you're past this, you're getting to that age where you just want to tell the truth, right?
Well, I'll start with a soft statement.
Okay.
Most of your doctors do not deserve the respect you give them. I can't make it clearer than that. This is all covered in my book, Primal Panacea, because that's a good single book to get because it talks about and gives you the documentation for the science of vitamin C, but just as importantly, it directly answers the question of Dr. Honeyhackey as to how can the most fabulous substance on earth be ignored and or suppressed. And I will tell you, and I think this is an understatement, so I'll be conservative. If vitamin C were quickly and thoroughly used in the proper doses for any medical condition, the indication or the need for fully 50% of pharmaceutical medicine would disappear overnight. So maybe that answers the question.
Okay. So at this stage, I think this group, first of all, I want to make sure if any of you have a question or a comment that you would like to direct to Dr. Levy, by all means raise your hand. Dr. Ann can bring the microphone to you. I think I'd like to hear you talk a little bit more about the whole phenomenon of dosing, because in my opinion, what happened is we got too hung up in defining scurvy as the deficiency of a small amount of a molecule that would relieve what we defined as a disease, scurvy, a deficiency disease, scurvy. And that's where this thinking stopped. And we didn't look at what would happen if we call this nature's remedy. In the natural world, animals can make so much more. Goats can make 1,000 times more when they're really seriously ill. So when we give IV vitamin C, which in the context of scurvy seems like a heck of a lot. Why are you giving so much, doctor? How did that little observation on dose response get missed in conventional medicine? Because I know there's all these studies say vitamin C doesn't work for the common cold because they give them 250 or 500 milligrams and they're not better. Was it just a dosage issue?
Well, probably one of the worst things that happened to vitamin C was being labeled a vitamin. Okay? It's a fabulous nutrient molecule that incidentally has a vitamin-like quality. Vitamin-like quality meaning in a tiny dose, it's capable of preventing the deficiency disease that's associated with it. So 60 or 100 milligrams of vitamin C will keep you from having generalized scurvy. However, you probably need 10,000 times more than that for optimal health. So it's really a nutrient with a vitamin-like quality, okay? And truly the most important aspect of vitamin C is how much you give. They have some old sayings, like in the real estate business. They say, what are the three most important aspects of real estate? Location, location, location. What are the three most important parts of French cooking? Butter, butter, and butter. What are the three most important aspects of effective vitamin C therapy? Dose, dose, and dose. I can't tell you how many articles there are in the regular medical literature, because let me tell you, vitamin C, even though you won't find a mention of it in the damn medical textbooks, it's been researched out the yazoo. I mean, they have 50, 60,000 articles in the medical literature on every aspect of vitamin C in treating or affecting just about every disease you can imagine. And most of the time, they'll use a microscopic dose of vitamin C, 60, 100, 150 milligrams, for an overwhelmingly oxidative stress disease, describe no positive results, and then say, therefore, the conclusion is vitamin C is of no use in this disease. Well, penicillin treats pneumococcal pneumonia very effectively, but you need millions of units of penicillin to do it. So what do you think is going to happen if you give somebody with pneumococcal pneumonia 100 units of penicillin? Nothing. So we'll go into this in a little more detail, but the point to always understand is that vitamin C is a nutrient. It's the single most important molecule to take into your body. And it's natural, it's designed by nature. It has no toxicity. I mean, that's something they like to jump on, but there has never been a defined toxic level of vitamin C. I mean, you can take enough vitamin C until you start pooping your brains out, but nothing much other than that. On the other hand, and sometimes people think this is a little silly, but I don't think it's so silly. Think about it. Would you consider water to be toxic? Well, how would you define toxicity if you took too much of something and it killed you? Isn't that toxic? You can reliably kill yourself if you just sit down and over the course of 15 or 20 minutes drink 2 or 3 gallons of water. You go into cerebral edema, you dilute out your electrolytes, you go into seizures, and you die. Well, I mean, obviously it's a silly thing. We know we need water, but even non-toxic things have toxicities when you overdo them. There is no overdoing with vitamin C. When you hear the bogus stories about kidney stones and these sort of things, well, anything can become toxic in a patient with renal failure. And when you have people with normal renal function, that little institution in the Northeast called Harvard has done these studies and found that not only does 10 or more grams of vitamin C a day not cause kidney stones in a very large group of patients, it decreases the incidence of kidney stones and helps resolve pre-existing kidney stones. The main concern about kidney stones is calcium. And that's a whole other story, far beyond what we're going to talk about today, but I'll bait you a little bit by telling you that another one of my books is entitled Death by Calcium. And the title is not an exaggeration. Never, 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 did I say never? Never supplement calcium. It's carcinogenic. It's the primary factor in causing disease in all of your cells. Okay? There's so many things in modern medicine, and it's a shame to have to say this, but there's so many things in modern medicine where the exact opposite of what's being advocated is true. Now, I'm not going to say there's some sinister evil plot out there to kill you, but I'm not going to say there's not either.
We, of course, we're talking today about intravenous vitamin C, the high doses of it. Does that knock out the role of oral vitamin C? I mean, some people say, hey, I take my 1,000 milligrams a day or 500 milligrams twice a day, and I take a little bit more when I'm sick. Is there, what's the take-home message with oral vitamin C and knowing that in more severe illnesses we're going to need a higher dose like intravenous, but what about oral vitamin C?
Well, this features intravenous vitamin C, and they do a lot of that here at the Reardon Clinic. And intravenous vitamin C is an absolutely fabulous therapy and will give you positive results for so many different conditions. For most conditions and most people, it's not absolutely necessary to take your vitamin C intravenously. But if you have the time, and you have the money, and you have the motivation, you can usually get on top of a clinical situation or an infection or disease much more rapidly and sometimes much more definitively with intravenous vitamin C. But long before vitamin C and intravenous vitamin C became very common, regular old vitamin C powder, sodium ascorbate or ascorbic acid powder, people have been decimating their infections and their diseases for many, many, many years now. But it's less convenient. I mean, if you're really dealing with a significant situation, if you're trying to improve your immune system when you have cancer or heart disease or this, that, or the other, your optimal dosing might involve taking a couple teaspoons every 4 or 5 hours throughout the day. Okay, so that's less convenient, but it can still be very highly effective. The goal, remember, not only is dose with vitamin C, but getting as much vitamin C where the pathology exists as possible in the highest concentration. So when you can get high enough levels of vitamin C where your cells are oxidized, a particular tissue, a particular organ, etc., that's when you begin to get the powerful effect of vitamin C. And to that end, to get there, sometimes, not all the time, not most of the time, but sometimes you need to take multiple forms of vitamin C. You need to take the powder. If you have a chance to take an IV every week or a couple times a month, that's good. And you also can avail yourself of a form of vitamin C called liposome encapsulated. Liposome encapsulated, even though you take it by mouth, and this is a one hard to wrap your head around. Took me years to wrap my head around it until I realized it was true, and I said, just wrap your head around it, dummy. And liposome encapsulated vitamin C, an equivalent dose taken by mouth, has such phenomenal absorption, and the encapsulation process makes it like a mini cell that it manages to get the payload inside your cells even better and more efficiently and consuming less energy than an intravenous application. It's just that intravenous, you can take a whopping huge amount of vitamin C, 50 grams, 100 grams. And so you can get a huge concentration. Doesn't last long, but you get an astronomical concentration for a limited period of time, and then it starts to get excreted out through the kidneys. The liposomes, on the other hand, take a much smaller dose, but most of it will end up getting inside the cells. So you can see how one complements the other. The IV is going to just sweep through your body, neutralize the toxins in your extracellular fluid, in your blood, and then you take the liposomes to get the vitamin C inside the cell and start reducing neutralized and oxidized enzymes. Because when you take large doses of vitamin C intravenously, sometimes even with liposomes, hey, you start to feel lousy. Why is that? Mind you, most of the time people just feel fantastic. But some people, they take an IV, 25, 50, 75 grams. Oh, I don't feel so good. Well, is the vitamin C doing something bad? Well, it depends on what you mean by bad. The vitamin C went inside the cells in such a high concentration that it donated its electrons to all these oxidized enzymes, detoxification enzymes, and those enzymes sprang back to life and started cleaning house inside the cell and dumping toxins out into the blood. And so you did end up having a detoxification reaction to the vitamin C. And it's pretty easy to understand that in the long term, that's highly desirable. But here at the clinic, we've also designed some methodologies so that when that happens, we'll have you feeling well by the time you leave. And it's an interesting phenomenon. It's called mop-up vitamin C. Really scientific term, huh? Mop-up vitamin C is exactly what it sounds like. But the really interesting, almost paradoxical part of this is you use the same thing to deal with the problem as the thing that caused the problem in the first place. But it's all a matter of rate and dose. So let's say you were taking 50 grams of vitamin C really fast and you started feeling bad. What do? Either when that IV is finished or before it's finished, if the symptomatology is too bad, is you slow it down or stop it, and then you're still feeling kind of lousy. Then you come in with vitamin C again, but at a much slower rate and lower dose. So what's that going to do? That's just going to get into the blood and neutralize all the toxins that have been released from the cells, but it's not going to be in a high enough concentration to continue to go inside the cells and dump out new toxins. So vitamin C is very versatile, and there's a lot of things you can do with it. And when you consider the fact that, and this may sound like an overstatement, but I've been looking for an exception for it for 10 years, and I have not found one. 100% of all diseases are mediated by, caused by, and worsened by increased oxidative stress, or an increased percentage and number of the biomolecules inside your cells and surrounding your cells being in an oxidized state. That is disease. Disease is nothing more than that, nothing less either. So there's a great, what I call, dichotomy of simplicity and complexity to human and animal biology. The simplicity is just what I told you. The simplicity is all diseases increase oxidative stress. The complexity is the different ways that oxidative stress is generated, all the different enzymes, all the different factors, and how you effectively neutralize and repair that oxidative stress. But the elegant part of it is it's all caused by the same mechanism. And once you realize that, especially as a physician, as you realize that, then you're able to effectively make all optimal health care a two-pronged solution. The one prong is do everything you can, by all means possible, to optimize not just vitamin C, but all the antioxidants where the damage is present so you can repair. So one side of the coin is to repair damage. The other side of the coin is to identify and eliminate and stop the new toxins coming in on a daily basis, which is what Dr. Huggins told me many years ago when I was asking him some questions about these issues, and he said, look at these. He almost was patting me on the head like a child. He said, Tom, I said, what? He said, you can't dry off while you're still in the shower. So how silly is it to spend in even quote unquote integrative complementary alternative medicine does this, I'm sorry to say. They spend all of their time trying to just repair damage and just don't even pay any attention to the elephant in the room, which is the onslaught of new toxins on a daily basis. And this is the subject of my new book, Hidden Epidemic, which talks about the fact that the vast majority, if you've got any type of disease that you're taking prescription medications for, I can tell you you've got some dental infections. And until they're effectively addressed, you can never expect to have the type of response that you would like to have. This is why so many cases of cancer, even when you use something highly effective, ozone, vitamin C, other things, and the cancer disappears, and then 2 or 3 years later it comes back. Oh, you never looked at the infections in the mouth. Infections are the most profound source of toxins and pro-oxidants. So, again, unless you turn off the shower, you can't ever expect to get dry.
Yes, go ahead. We have a question from the
Yes,
audience. Well, just a
Okay,
second.
wait
She's
for
going to
the
bring the microphone up here. I was going to say while the microphone's coming, it's no coincidence that the highest source of vitamin C in the body is the adrenal glands. And if oxidative stress, and that includes all forms of stress, whether it's infection, toxicity, emotional stress, sleep deprivation, any of these kinds of stressors, vitamin C would be nature's remedy if we had the gene to make the vitamin C. We have the gene, but it's mutated, so we can't actually make the vitamin C. Go ahead.
We keep hearing over and over again, as we age, we can't do things. We can't absorb this, we can't absorb that. So does age make a difference in the amount of C that you take?
Age per se does not make an amount of difference in the C that you take. What does make a big difference and causes tremendous variability from one person to the next is what is your unique daily toxin exposure? What is your unique distribution of oxidized biomolecules that you already have in your body? And I got to say, when I was looking at Dr. Klenner's work, who pioneered all of this stuff 60 years ago and reported on how he treated all sort of different infectious diseases, I consistently saw, or at least it was my conclusion, that he was getting results with about 2/3 of the amount of vitamin C that we need to use today. And I think this is because our environmental toxicity has gone up astronomically. So your vitamin C has to deal with that many. I mean, it's not magical. I mean, one vitamin C molecule takes care of one toxin. So if you just keep on adding up on the toxins, you gotta get that much more vitamin C in order to ultimately get the outcome that you want.
One of the real challenges that we've always faced with IV vitamin C is not only do doctors not know about it, but a lot of doctors function according to their education, but also according to a legal standard called the standard of care. And generally speaking, throughout the country, the standard of care has not included IV vitamin C, and so there's been a reluctance on the part of physicians to make use of it. We are in the process of, and we have developed and are ongoingly now providing an IVC Academy. We're doing it this weekend for about 50 doctors here at the Reardon Clinic. Dr. Levy and I just got back from Paris and Tokyo, where we provided IVC type academies. And so the standard of care has been a problem, but there's been something new happen in the research on vitamin C that I'm hoping Dr. Levy can fill us in on, that I think is changing the standard of care such that you and family members who become seriously ill in the hospital, where I have no real jurisdiction, but you as a family member or as a patient, you do now have the ability to request IVC. And why is that so?
After this happened, I wrote a little article called Vitamin C, the Genie, Vitamin C and Sepsis, the Genie is now out of the bottle, which basically means that it can no longer be suppressed. What happened is about a year ago, a doctor in Virginia, fairly mainstream doctor, but he was open-minded and he read articles on vitamin C and Dr. Klenner and everything. And he was the director of the intensive care unit in a small university-based hospital. And I might add that I had always predicted, Swami here, that what was needed to break vitamin C through was, number one, because until about a year ago, you could not get vitamin C in any hospital in the United States, period. Period. Okay? Now there's a limited number. And I said, what we need is we need a doctor who is king of the hill in his or her hospital. Nobody senior to him or her, no pharmacy dictating. I mean, you can think about it. A lot of little community hospitals where the doctor in charge is God. If he wants to do something, he does it. Well, that was the scenario in this hospital. Dr. Paul Marek ruled the roost in his intensive care unit. Everybody did whatever he wanted to do. So, he knew a little bit about vitamin C. He knew a little bit about hydrocortisone. And he also knew that people in sepsis and septic shock died. Matter of fact, I'll say this, septic shock and sepsis is the #1 cause of death in the hospital across the world. If you die in a hospital, most of the time, the final common denominator was you had overwhelming infection that destroyed your blood pressure, shut down your organs, and you died. It's called sepsis and septic shock. Well, Dr. Marek had a young woman in septic shock, and he had been thinking a long time about Klenner. He knew already that hydrocortisone by itself had no effect in septic shock, even though it was very good for regular shock. What I mean by regular shock, like allergic shock. Regular shock where shock occurs without overwhelming sepsis being present. Then hydrocortisone would bring him right out of it. He had also read that vitamin C did a lot of wonderful things. So he was getting ready to leave the ICU one night, and he said, go ahead and give Miss Jones 1.5 grams of vitamin C and 200 milligrams of cortisone every 6 hours. He came and he fully expected her to be dead the next morning. just because that's what he saw all the time. Well, he came in the next morning and she was sitting up and eating. He said, my God, what have I done? And he did that for 54 more consecutive patients, and then published a paper comparing them to the 54 previous patients that had just got antibiotics. Mind you, they're on maximal antibiotics. They're on medicines to keep the blood pressure up, everything like that, whole ball of wax, and you just die. On the subsequent 54 patients, with the mortality rate of sepsis being nearly 50%, nearly 1 out of 2, once you have diagnosed sepsis, he saw in the next 54 patients, this many people die of sepsis. And then what was the worst thing that could happen? The nurses and everything started talking it up, and next thing you know, it was on the local television news. Now the genie was out of the bottle forever. Because, and he's doing this more, he now has, he's got his critics, you betcha. But he's now got little satellite places throughout the country reproducing this information. But the point being, the point I make to you, and if you've got somebody in the hospital right now in the intensive care with sepsis, you better not wait. You need to go whenever the occasion occurs. Because remember that vitamin C is cheap, it's effective whether they would argue it or not, and it's non-toxic. But who cares if it's the most toxic medicine on the planet if somebody's going to be dead 24 hours later? The point being is you and your loved ones have the right to this. There's the lawyer side of me coming out here too. The only people that can keep you from receiving your rights is you. Don't let people take your rights away. Don't let some brain-dead physician kill your loved one. If you have a patient, a family member in the intensive care unit diagnosed with septic shock, you could be polite at first. That's always a good approach. But you tell the doctor in charge you want them to receive vitamin C and hydrocortisone, just like this protocol with Dr. Marek, and you can hand them the freaking paper. But you promise him or her that if your relative dies and he does not do this, that you will sue him directly. And not everybody, not the hospital, not this, not. Doctors have a herd mentality. They're like a bunch of freaking little babies when you cut them out of the pack, all by themselves. Okay? So, and let me tell you, you'll win that suit. Or 18 out of 20 scenarios will win that suit. Because the evidence is now there, and there is absolutely no defense. You can flip the whole emphasis around, and I can tell you that the literature as it exists right now, not even with this new data by Dr. Marek, the literature as it exists right now, if these doctors were yanked into a court of law, it would prove to be malpractice for them not to use vitamin C routinely. Because remember, all these infections cause scurvy. And that's the primary reason that the sepsis patient dies, is because they're in a case of acute scurvy and all the vitamin C has been consumed and they can't possibly sustain a blood pressure without vitamin C circulating in the vessel. There's a lot of very interesting points as to why these two things work well together. That's not so important right now. The important thing to know is it works, it's been proved, it's cheap, it's safe, and the only reason your doctor has for not using it is being an arrogant son of a bitch. Don't let him, don't let her do it to you. You have the power, but you and you alone have to take out a mortgage on the house, get the lawyer, this, that, or the other, but you got to put teeth behind the threat. Okay? Or you demand to have your loved one transferred to another hospital where it can be administered. So, but it's really very exciting. This is the first major wedge that we finally have for the most fabulous therapeutic substance on the planet to finally be getting its wings.
We just came from Paris, and I met for the first time Alan Smith. And for those of you who've been on YouTube, what is it called? What is the tube? It's a 60 minutes from New Zealand.
It's 60 minutes. It's called Living Proof. It's about a 16-minute clip. You could probably just go on YouTube and type in Living Proof 60 minutes, and you'll go straight to the video. You can also get the video on my website, peakenergy.com. But either way, and let me tell you, no exaggeration, you better have a box of Kleenex with you when you watch it. It's pretty overwhelming. Even at this stage of the game, it brings me to a puddle to watch it.
So in my mind, the exciting part of all this is that we live in a time when chronic illness has now become the dominant form of illness. There was a time in history when acute illness, plague and various things struck fear in people's hearts, and we didn't have anything we can do. And now it's not that we want to demean acute care medicine. As I always say, if I'm in a car wreck, don't bring me to the Reardon Clinic. It's going to take much more. But with all the various chronic illnesses that we have to deal with, heart disease, cancer, depression, autoimmune diseases, Alzheimer's, these are all well on the rise. And here we have a very effective tool that can be used in conjunction. It can be used adjunctively with other therapies. So it's not necessarily us against them. It can also be, let's work together to get the best results for our family. But in the past, that plea was often ignored. And now we have evidence in a situation where there can be no quibbling about what actually made the difference. Sometimes in cancer patients, when they would their cancer would resolve, oh, it was a misdiagnosis. They really didn't have cancer. Oh, they were going to get better anyway. So many things like that. In this case, sepsis had a 50% death rate. And with the addition of vitamin C and the activation of the hormonal system, one of the things that Dr. Levy didn't get into that's really interesting to me is that oxidized receptors in the adrenal gland don't respond properly, and so you don't make the hydrocortisone you need to adapt to stress. So vitamin C basically turns on all of the adaptive mechanisms that our body needs to deal with the various major forms of stress that we face in our life today. Yes?
I have two questions. Thank you. One, how does somebody know if their dental health is not good if they don't have any uncomfortable symptoms?
That actually is the whole point of this book, and there is a test available. It's called a three-dimensional X-ray of the mouth, three-dimensional cone beam imaging. Most places it runs about $300. Probably in New York City it costs more. Maybe in Wichita it costs a little bit less. Virtually all doctors who do implants have a machine. Depending on your city, some of the general dentists do, but all the implant doctors and most of the root canal doctors have these machines because it helps them better map out the pathology. But the point being is, when you just get the regular Panorex X-ray, that's probably going to miss a good 30% of all infected teeth. That the CD, literally, it's a fascinating piece of equipment. Once you have it all done, you can just, it's like Star Wars. You can just sit there and just go at all different angles so you no longer have artifacts because it's hiding between one area. You just come around. And the cover of my book, Ann can show it to you, is Patient Zero. That was my friend a year and a half ago who was getting 3 root canals taken out, and she was getting this x-rayed, and the 4th tooth, which wasn't even a target, had a huge abscess on it, eroded through the bone into her sinuses. She'd had horrible sinusitis all her life. And I said, Cindy, I said, does that tooth hurt you? I said, no. She said, no. I said, come on, it has to hurt you. No, it feels fine. And then, just like a light bulb went off. I said, my God, you could have that type of pathology in your mouth and feel perfectly fine. You have to look for this to know it exists. How do you diagnose diabetes? Do you look at somebody and say, you look like a 250?
Don't say it to a woman.
A 250 blood glucose. No, you got to measure the blood sugar. So if you have a grossly infected tooth in your mouth that doesn't show up on regular x-ray and doesn't hurt, how are you going to find it if you don't look for it? So I make the case this new technique should be part of the general workup of anybody being seen by a dentist or a physician. Even more so if you have a diagnosed disease. If you have a heart disease, or you have a breast cancer, you better not go. You better run to get one of these tests, because there's an excellent possibility that the primary pathology for your heart attack and your breast cancer is never being addressed. And we have the clear data that shows over 90% of all heart attacks are directly caused by the pathogens from infected teeth and gums. Over 90%. Clear. Now, I'm not talking about correlation, link. I'm talking about cause and effect.
Thank you. The
You have
other
number 2
question
question.
has to do with hormones. If someone has disrupted hormone or imbalanced hormones and a condition like, say, PCOS or some other thing, is that correlated with vitamin C? Can that be corrected by additional vitamin C?
Nutrient deficiencies, correcting them will help, but if the levels are still abnormally low, they need to be addressed.
Yeah, I think what you have to do is you have to look at the whole situation. Dr. Reardon and myself, we always look upon what goes on at the Reardon Clinic as detective work. And we don't want to ever stop thinking what else could be involved, because more often than not, chronic disease is a multifactorial situation. And so you have to look for all the underlying root causes and try to weed those out. And as you do, then these diseases that appear to be non-treatable, unresponsive other than brute force of medication, they will start to improve. So it's a fascinating realm to be in. That's why a lot of people say, are you retiring? Are you retiring? I said, heck no, I don't want to retire. It's just getting so much more interesting as we now have tools to help us discern what are the sustaining factors. Dr. Reardon did not like the term chronic illness. He said, if you use the term chronic illness, you're more or less assuming in your mind that that's it, you got it. There's nothing you can do about it. He liked the term sustained illness. And what is sustaining the illness? And that's the hunt that we have to all be in, that when you're dealing with a chronic illness, what else is going on there? I might mention C-reactive protein and reverse T3, which are 2 tests that we commonly do here, can be clues that maybe there's something going on in the mouth. They're not definitive.
Also, you brought up something that the perfect timing for this, because in talking about infections and its impact on heart attacks, breast cancer, and others, is intimately involved with your hormone status, okay? If you have low estrogen or low testosterone or low thyroid, these incredibly magnify the ability of your infections in your mouth and elsewhere to disseminate. Whereas when those levels are kept well within the normal range, it's incredible how well the body will actually wall off infections and allow you to live reasonably normally and coexist with your infections.
Was there any other questions? Oh yeah, we got some questions.
You mentioned a little bit ago about using the powdered vitamin C. Is that much better than using just the vitamin C in capsule form that most people take?
Well, it's much better than taking the vitamin C in tablets. But capsules, they melt quite nice, and if the only thing you have in the capsule is the gelatin capsule in the powder, that's perfectly fine. But beyond that, you shouldn't take anything that's further adulterated.
Okay, thanks.
On the oral disease thing, is that typically treated through extraction then, or can that be treated with medication to try to eliminate or reduce your exposure to things?
Once a
worse?
tooth is infected with this radiological evidence of abscess, it is dead. Okay? So you can't resolve the infection in the traditional sense of infection. Now, what you end up doing, and I got to say, I wrote a book with Dr. Kulas talking about the horrors of root canals. I've since learned that there are some subsets where root canals can be much, much, much less toxic. So the worst thing you can do is leave this abscess tooth in your mouth untreated. The best thing for your health, strictly from your health, is a proper extraction and cleaning of the socket. Some people don't want to consider the possibility of an extraction, and that's their right. And two other options then, if the primary recommendation of extraction is declined, is to have a high volume endodontist do a root canal and make sure that the CRP doesn't go up, that there's not residual abscess around the tooth, and that you have a quote unquote good root canal, because root canals are always infected. You never eliminate the infection, but you can contain it, okay? So if it ends up being a good root canal, no bad CRP, no bad lipid panel, that you can work with. The other option is extraction immediately followed by implant. Sure.
In general, I think just the whole notion of taking better care of your teeth. Dr. Levy likes to recommend water pick cleaning with a cap full of peroxide, something like that. Really carefully brushing, taking your vitamin C and oral amounts so that you at least do not have bleeding gums or infected gums, swollen gums. These are all really good practices. There's a whole nother area of metal detoxification, mercury fillings. And that can be a major problem too. But the chronic infection is the highest source of toxic load in the body. So that's one of the number one priorities that you want to search for. Has this been helpful to everyone? Yes. Yeah. So the theme of
or does it just scare the hell out of you?
Yeah, it should be motivational more than anything, and that the fact that the IV vitamin C sometimes is not the full answer, but it's a great stepping stone towards the full answer. Rather than saying there's nothing I can do, you can do that right now while you're planning the next step, and it's going to reduce your toxic load.
You can always help yourself with vitamin C. The question with these other things is to what degree. I mean, if you do all the vitamin C and you get rid of all the infections, you might have leaps in your health that you thought were impossible. But if it's too much, if it's too overwhelming, don't just take the idea that that's too complicated, I'm not going to do any of it. That's silly. You can still supplement with high quality because you can't remotely get enough antioxidant capacity from the best diet on the planet. Go ahead.
That's kind of where I was going with my question is, are there certain foods that can contradict the whole vitamin C treatment? And are there foods that can aid in the benefits of vitamin C treatment to help see those benefits quicker?
Well, I mean, any food that has a lot of oxidants in it is going to be counter to the effect of vitamin C. I mean, the whole purpose of organic food, or even gluten-free for that matter, is to minimize the toxins that are present in the food. But let me quickly say, the most significant toxicity from a bad diet comes from bad digestion. I mean, bad digestion, rotting and putrefaction of the food, not being able to walk into the bathroom after somebody else is in it, the overwhelming, that's putrefaction. That's not digestion. And if you have the worst diet in the world, if you eat McDonald's every day but you digest it perfectly, you're going to have less toxicity than the finest organic diet imaginable, but you violate every digestive rule. Obviously, the best thing is quality food, properly digested. But digestion is a huge, huge, huge factor in promoting and sustaining chronic degenerative disease, because many people are in a habit of eating, a habit of not paying attention to food combining, and a dozen other things that undermine good digestion. And it's like they have a couple more root canals from their mouth and their gut for the amount of toxins that they continue to generate on a daily basis. And vitamin C flushes can help a lot on that too. You take a lot of powder all at once, a lot of water, and then most of the time you're going to have a loose diarrhea. It's good. It flushes out all the rotting food and much of the toxins before they have a chance to get absorbed.
I think we're going to have to stop. We're past the hour, but we'll hang around here. Thank you very much for coming today, and for those of you that attended the other parts of this IBC series. It's available at RiordanClinic.org. If you go on YouTube, Riordan Clinic, and type in IBC, you can watch the whole series. So thank you very much for coming today.